IBS and celiac disease can be confusing because there is often a great deal of overlap between these two conditions. Both can involve the exact same symptoms, though they don't have to, or they can be completely different. And one can even cause the other. Yeah, confused yet? Well, let's talk about IBS versus celiac disease. Hi, I'm Dr. Stephen Wangen, the founder and medical director of the IBS Treatment Center and a nationally recognized expert on celiac disease and gluten intolerance. And if you like this video, please click the thumbs up below. The difference between IBS and celiac. IBS is defined by symptoms. All IBS sufferers have one or more of the following symptoms. They either have abdominal pain, diarrhea, constipation, gas, or bloating. And they don't have to have them all, but they have at least one of these symptoms. An IBS sufferer and someone with celiac disease may have the exact same symptoms, or they may have completely different symptoms. But IBS always involves these digestive symptoms, but celiac disease does not always involve digestive symptoms. Now, many people think that celiac disease, like IBS, is defined by digestive symptoms, but it's not. Celiac disease is defined by a very specific kind of damage found in the small intestine called villus atrophy. This damage can be seen under a microscope, and it can also be diagnosed with a blood test. Now, IBS symptoms versus celiac disease. People with celiac disease may have one or all of the same digestive symptoms that we talked about seeing in IBS, or they may not have any digestive symptoms at all. Now, they might have fatigue, or they might have brain fog, or they might have osteoporosis, or they might have headaches, or they might have a skin rash, or one of any other of the 100 or so symptoms associated with celiac disease. In fact, people with celiac disease, get this, may not have any symptoms, digestive or otherwise, which is a strange but often true fact about celiac disease. But they always have, people with celiac disease always have that specific damage in the small intestine called villus atrophy. Now, IBS is defined by the symptoms, versus celiac disease is defined by the diagnosis, like we just described. So, do you have celiac disease or IBS? Now, when the symptoms are the same in these two conditions, as they can be, and they often are, it's impossible to tell the difference between celiac disease and IBS without testing for celiac disease. And there is no test for IBS. So IBS is an umbrella term that covers people with digestive problems for which no better explanation has been given to them, right? It's what's known as a diagnosis of exclusion. So what doctors do is they exclude everything else, and then they leave you with IBS. And of course, it's a very unsatisfying diagnosis because it's just a label. It's not a solution. And so unfortunately, many people receive very poor care for their IBS because that's all they've been left with is that label. But celiac disease is a very clearly understood condition with a very clear treatment. And one of the things that must be ruled out in IBS patients is celiac disease. So the testing for celiac disease, like we said, it's fairly simple. A blood test can tell you if you have it. So if you have IBS, then you need to be tested for celiac disease because celiac disease can cause IBS. And if you do have celiac disease, then avoiding gluten, which of course is the treatment for celiac disease, may solve your problem. Notice I said may. We'll get to that. Now, does gluten make IBS worse? Well, celiac disease is always triggered by gluten, right? That's just what celiac disease is about. But IBS may also be triggered by gluten even when you don't have celiac disease. So celiac disease is the most well-known form of gluten intolerance, but it's not the only form of gluten intolerance. There are other types of gluten reactions known as non-celiac gluten sensitivities, And sometimes these non-celiac gluten sensitivity reactions result in IBS. And in such cases, gluten will make your IBS worse. However, there are literally hundreds of other causes of IBS. And although gluten can make IBS worse, or even be the sole cause of your IBS, most of the time gluten is not actually involved in IBS. But something is, right? There's got to be a cause. And this is what an IBS specialist helps you do, is they help you sort out the cause of your IBS so that you can get better and no longer have IBS or digestive problems. Now, can you have both celiac disease and IBS? Yes, you can have both celiac disease and IBS. And this is a relatively common problem, and it's fairly easy to diagnose, because if you test positive for celiac disease, then of course you need to avoid gluten in your diet. And if you avoid gluten but you still have IBS, then you have both. You have celiac disease and you have IBS. And in cases like this, celiac disease is only one of the factors involved in your IBS. And actually, it may not be a part of your IBS at all, meaning that you can have celiac disease and have it not be the primary cause of your digestive problems. There are other causes of IBS that can be diagnosed and treated so that you can solve your IBS. So it might be about a lot more than just celiac disease. Would you like help in sorting out the cause of your IBS? If you'd like to hear more interesting content like this, please subscribe to my channel below. Thanks for listening.